If you're a road cyclist or a mountain biker or something in between, sometimes little aches and pains can come up on the bike, and we want to stop them before they turn into a bigger injury. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and today I'm going to talk about 3 little injuries that sometimes come up on the bike and how to stop them from turning into something bigger. Now, a lot of what I'm going to talk about today can be helped by a good bike fit. So particularly if you're a road cyclist or a triathlete, I really encourage you to have a proper bike fit by a health professional who's trained in bike fitting or a good bike shop to make sure that your bike is set up specifically for you. Now, the first injury that I want to talk about is neck pain. This is a common complaint when we're on the bike, and it could be because of neck position, poor form on the bike, or it could actually be fatigue. So what you're experiencing is a weakness in the core muscles of the neck. We call these the deep neck flexors. We have to be in that sustained posture for a long time, or if you're on the mountain, you're bracing over roots and rocks. It's a lot of vibration. If your core isn't strong enough to handle it, it might present as a bit of neck pain. There's a simple exercise you can do to help that called chin tucks or neck retractions. And all you're going to do is make a double chin, lengthening the back of the skull, hold it for a few seconds, and release. You can do it like I just showed you in the air, or I encourage you to do it against the wall or the floor so you can get that feedback that the back of your head is touching. You want to feel it deep in towards the throat, not so much off to the side. That muscle, the SCM muscle, is going to want attention. Try to keep that relaxed. So doing a little bit of core strengthening for the neck specifically might help minimize that neck pain on the bike. The other issue that sometimes comes up on the bike is back pain. Now, it can present in all different parts of the back, but often in cyclists we feel it not so much in the middle back or the lower back, but in that transition where the curve changes to go the opposite direction. So often that can be because we're hunched and rounded on the bike, but I'm also interested, what are the muscles that attach in there? And there's 3 that I'm concerned about. So the first is the quadratus lumborum, or QL. It attaches from the pelvis up to that spot on an angle on both sides, and its job is to extend the back. So when you're in that rounded position, it's pulling back on you to hold you up so you don't fall forward. So it's under constant tension. The other one is on the opposite side. The psoas muscle, or hip flexors, attaches from that spot and goes down into the hip joint. So it lifts the hip with every pedal stroke. So it gets a lot of use, and it can tighten and pull on that spot too. Then, coming from above, we have the lats. So they attach from the shoulders down into that spot. So that can often present as tightness in the back of the armpit area. So if you're a triathlete, lats can often get developed from swimming, or maybe you're a weight trainer. That can tighten and pull on that spot as well. So not just thinking about bike posture, but also thinking about, okay, what are the muscles that are pulling and tensioning that zone can be helpful. So making sure you do stretches to address those muscles. The last one I want to talk about is the numbness and tingling in the pinky finger. So often this is suggested that why don't you wear gloves that have a bit of padding so there's not as much compression there. That might be helpful. Change your grip, change the position of your handlebars. All helpful suggestions. But if you were coming to me, I would want to know, okay, what about where that nerve is actually starting? And it exits out of the spine between the 6th and 7th vertebrae in the neck. So often we can sometimes get shoulder shrugs or head forward, and both those things can put pressure on that nerve. And we want to take away that pressure. So you can think about your posture, definitely getting shoulders down and head back. But sometimes the limiting factor is actually the thoracic spine mobility, the middle back, and how well that moves. So if you're constantly in this rounded position and it's hard for you to straighten up, then the head naturally goes forward, the shoulders roll forward, and we're compressing right in that junction between the neck and the upper back, right where that nerve comes out and goes to the pinky finger. So it's important you have a little bit of a mobility routine for the thoracic spine, particularly focusing on the opening of the chest. Now, if you have a good bike setup, you pay attention to some of these little niggly injuries when they come up, and you do a little bit of work off the bike, doing a few exercises and stretches, that's going to go a long way to preventing these things turning into something bigger. My name is Dr. Robin Armstrong. If you have any questions about what I talked about here today, please feel free to ask. I'm always happy to help.